Hi, my name is Leslie Stach, and I'm a former transplant pharmacist turned West Coast medical science liaison for Transplant Genomics, where we're working hard to provide meaningful laboratory testing for transplant patients. We want to recognize all the hard work that is being done by our frontline healthcare workers who have been tirelessly dedicating their lives to caring for our moms, dads, children, siblings, and friends who've been affected by COVID-19 this year. We want to thank you for your dedication and the sacrifices you have made and continue to make every day. At this difficult time, we are trying to provide solutions to challenges facing the transplant community. We know that one of the challenges you currently face is the routine monitoring for immune activation in your stable kidney transplant patient. We care about immune activation for many reasons, but one of them is silent subclinical rejection. In a recent article by Dr. John Friedewald and colleagues that was published in the American Journal of Transplant, it was reported that the prevalence of silent subclinical rejection is about 25% in kidney transplant patients with stable renal function. Silent subclinical rejection can have many deleterious effects on the kidney graft. From some recent literature, it has been shown that early silent subclinical rejection may lead to increases in acute and chronic rejection, declines in estimated GFR, IFTA that ultimately would lead to graft failure, and increase in de novo donor-specific antibodies. Silent subclinical rejection is completely undetectable without doing an invasive surveillance biopsy. Biopsies are challenging, logistics are difficult, and time-consuming for healthcare professionals, not to mention burdensome for patients. With the current COVID climate, biopsy can be even more difficult and less popular with patients who do not want to leave their homes. And all healthcare providers want to decrease risk for their patients, and we are here to support that by also having a mobile phlebotomy service called Labs at Home. TruGraf is the only biomarker that is validated and available to inform on the state of immune activation in your stable kidney transplant patient. With a TruGraf transplant excellence result, you can be confident that the allograft response is quiescent, effectively ruling out subclinical rejection, and a biopsy can be avoided. TruGraf is here to maximize your ability to monitor your patients more frequently and minimize their exposures. Please visit our website, trugraf.com, to learn more about how TruGraf can benefit you and your patients.